Well, I'm now absolutely delighted to be joined by Dr. Kevin McVary. Dr. McVary, welcome.
Thank you.
Lovely to have you. Now, you're chair of the AUA's Public Media Committee.
I have. I've been the chair for 2 years, been on the committee for a number of years.
How important is it for the AUA to be able to reach out to the public in this way?
Well, I think it's a critical piece of the mission, and it's a different kind of relationship than other parts of the AUA. And that's because, in a way, we're the face of our association to the general public, to the media, to not just patients, but the community at large. You know, general people, not necessarily people with diseases.
It's a tough job, isn't it? Because you look around this conference and there's a lot of science here, and yet the public as a whole, you know, it's a bit of a messy process, isn't it, dealing with the public in that kind of way?
It's an important process. And it can be confusing, and part of our job is to maybe distill out the messages that are pertinent for the community to understand, for their own health, and also to realize what advocates we are for the healthcare system, for our patients, for their health.
Talking about those messages, what are some of the key messages right now that you're trying to get out in the field of urology?
Well, specific areas is obviously prostate cancer is a huge controversy. We're trying to distill some distinct messages about how urology intends to approach the controversies in prostate cancer, the controversies in PSA screening. It's why it's important to focus on at-risk groups. We're interested in aspects of general health that urology impacts, kind of global diseases that impact urology specialty areas, as well as other urology diseases which may have a systemic impact on people and patients.
What would you say are some of the misconceptions that are out there at the moment that you're battling against?
Well, there is a lot of activity in the media that's generated on medical issues, on health issues, and a lot of this activity is probably not based in solid science, and part of our that's a generous way of saying it probably, and so part of our job is to draw lines and to make distinctions between what's proven, what's accepted, what is a good policy, and maybe other things which either need more testing or perhaps leave it alone.
Well, finally, what are some of your goals for this year? When you're looking at this year, what would you say some of your goals are?
Well, I'll tell you, there are a couple of, the prostate cancer message I think is an important piece of what we've done. The influences of obesity and how it influences not just overall health, but specific urology type diseases. And there's advancements in basic science that we also try to distill and get out there for our patients and for the federal government, for funding agencies to understand how these new discoveries can be exploited for people's benefit.
Well, thank you ever so much indeed for taking the time to talk to us today. It's such an important job that you've got there, so thank you very much indeed.
It's my pleasure.
Thank you.
Glad to help.